talking about sex is like a very difficult subject to approach. Like what I've told you just now, right? It's a very weird subject to talk about. Like we aren't built to talk about sex as openly as we should be talking, right? I think there's a perception of what everyone has the idea about, right? But how look, if a new client, right, just walked into the room and just go, hey, look, I have a problem with that. How would you approach it? How would you broach the subject?
The client comes in, I'll just ask them what made them decide to come and see me, because most of the time my clients who come in for private sessions, they actually have a sexuality or relationship issue. So it's not so much the topic, but the problems around this. So also by the time they come and see me, I think they would have thought through what they want to say and what are their desired outcomes. So it's really not that challenging. Also, often they are paying for the session, so they are very aware that the clock is ticking. Yeah.
So okay, so I suppose like because I'm a Grab driver, right? And I would say I'm like a $12 therapist, right? Because and after a while, you just get to realize everyone, as much as you want to say like they have different problem, but it feels like it's the same book, but different chapters. Feels like everyone's talking about the same thing. Everyone has has a very similar problem. Are there any common problems that people talk about that kind of like affected their sex life?
Yes, I think ultimately we are all humans and all the problems are similar. So in my view, a lot of my clients have unconsummated marriage, vaginismus, which is a condition where the vagina shuts down, making penetration difficult or impossible. They come in with premature ejaculation, erectile difficulties, delayed ejaculation, low sex drive, difficulties around sexual communication. These are the common ones. And then there will be other kind of things that they will have. Like, for instance, they want to navigate like sexual healing or from having had trauma. People who want to navigate opening up a relationship or BDSM. But most of my clients are actually the first 5 that I mentioned.
So it's like unconsummated relationship.
Unconsummated marriage is the first one.
Yeah. So okay. So how people go about and do it then? Like the, do you see any common problems that lead to that situation?
Yes. I think it's like what you mentioned just now, the fact that we don't talk about sex as a society, and that leads to a lot of stigma around it, and then it leads to difficulty to talk about it, because we don't talk about it, then people starts to absorb this culture, this thinking, and because we don't talk about it, it becomes like a bigger problem than it needs to be, because there are people who can benefit from just being able to talk about it without really like needing to fix it. Even just talking about it, accepting it is part of the stages of looking for solutions. So yeah, I feel that the lack of sex education, the lack of sexual conversations, the lack of a positive sex culture, by and large, is very damaging.
I'm here as a devil's advocate, right? I'm gonna ask a question that's going to be a little bit weird or wrong in a sense. What do you mean by sex positive conversation? Like what happens if a place in a society where, look, there's time and place for that conversation, right? There's time and place. Like when would be a right time and place to do that kind of conversation? Because it feels like sex to me is like a very intimate thing, right? Although I joke about like having to pay for one, right? But I also feel like, okay, look, sex is a very intimate thing. You need to be in the right mindset to talk about. There's some conversation that I would not go about and tell everyone about my sex life. I think that's pretty disrespectful for both who am I talking to and to my partner, right? If I have a long term partner, right? So that's the problem that I have, right? So where would you put in along the line where, okay, look, this is a subject that we need to broach, we need to talk about, but when will be a good time to do it? Because you can't do it. I don't think you'll be comfortable enough to do it in a co-op school. You can't do it just a pure boy school. If you do it in a pure boy school, it will be like a subject that everyone tease, everyone joke about, and it's a very biased point of view. Girls will be the same thing as well. They will form very biased if it's not taught properly. So, what would be a subject? In what way would you go about, or in what kind of situation would you think would be a perfect place to talk about sex?
There's no perfect. Life is not perfect in the first place. There's no perfect. There'll never be a perfect. So I disagree with you that it cannot be in schools. Just because people laugh about it, I think that's part of their own shyness, awkwardness, shame around the topic. Just because people are shy about it doesn't mean that it doesn't need to be taught. And while they're in school, that's the best time because they are actually going to experience puberty. They are going to want to explore relationships. And if the parents are not talking about it, then whose job is it? Is it the government? Is it the schools? Is it the parents? So I feel that there needs to be some kind of public responsibility as well because our sexuality, our sexual rights is coming from the angle of human rights. So we are actually entitled to sex education. And so schools and the government do have an obligation to take care of the public and also take care of our education because people with the most amount of information and knowledge are the people who are most equipped to navigate this.
So who is the one that would you think that is the most well-equipped? Because I don't think teachers are very well-equipped in teaching sex education.
Yeah, right. So this is why in the last 10 years, MOE has stepped up, coming from the fact that I came from a upbringing where I had no sex education. Every year I have the yearly assembly where the girls have to march into assembly and listen to how we have reached puberty and we need to be clean and we need to use menstrual products, and it's sponsored by Whispers, like that's more about functionality. There was nothing about sexual communication, nothing about STI, nothing about like gender roles and female empowerment. So it was very belittling to separate the girls and the boys separately when actually it needs to be a conversation that all of us can have. And these people are going to grow up to be young women and young boys, and they are already young ladies and young men. So why shouldn't they be learning these? Because sexuality is not just about sex. It's also about healthy relationships. It's also about communication. It's about learning how to listen to your inner compass. So I don't feel that it's like a job per se for one organization or one body. I feel that everybody should do it. It's just like everybody in the ideal situation should think of all of us as interconnected. And there's this saying, it takes a village to raise a child. So even though I don't have a child, I feel very close to my best friend's daughter, and I see what her family needs, and I reach out and I try to step in as the de facto auntie, even though I'm not. It's just the affinity that I have towards this girl, and everybody can play a part towards the raising of a child. Like for instance, bystander intervention. You see someone being bullied in public, as the older person, you can step in and say something about it to plant a seed, even if you feel that you're not making a direct impact, but maybe you're making an indirect impact.
So what would one person do to change the idea, to change the perception of sex to everyone? Because look, it's you're talking about someone coming in with like someone making a huge change, or like everyone making a huge change, right? So right now is the whole society. I'm painting a very macro, a very big picture here, right? Because everyone needs to do this, but not everyone is equipped in every sense of the word, right? Is equipped to to talk to someone about this,
Yes.
right? So, like I said, right, I can't talk to that. There are some people, right, that I talk to that I'm not close with. Like, there are some people, there are some conversation that I have with comedians, right, with artists, and there's some conversation that I talk to people who are out of this realm of conversation that does not interconnected, right?
Yes.
So how would you bridge across the subject and say, oh look, everyone you talk about sex. So what's the thing that would you think would be a good way for one individual to do to bridge the idea of sex? Because as a guy, right? As a guy, if I were to talk to sex to say another little boy, there'll be a very, very shady perception about me as a guy talking to a young boy about, look, this is what happened to sex, or even to young girls about, look, this is what happened.
Yeah, ultimately it's about consent. So it's not just what you say, it's the way you say it, but also asking them whether they are open to hearing about it.
But still, it's, yes, if the child is okay, but it's sometimes it's also the adults that are looking in as well. So it's really scary sometimes, right, as a guy, to go about and say, hey, look, so hey look, you can't, look, Sarah, you can't
Yes.
there's this thing about,
But we also don't want to be going around giving unsolicited advice. It's also not our place.
okay, but as an adult.
No. Even though I'm a sex educator, I don't go around telling people what to do with their lives. I don't. But if I see something that maybe there's a time and place and I have a connection with this person, I might ask them whether they are open to having a dialogue around it. That's all. I don't go around feeling like everybody needs to be fixed. It's unfortunate that we don't live in an equal society. Everybody have different access. So it's also about accessibility. It's also about the level of education, intelligence, curiosity that someone will have. There are people who are going around with blinkers on, focusing on just food on table. So they wouldn't be thinking about these things. But the only time they would think about sex education if something happens. For instance, they have a child and the child is asking them questions that they can't answer. So being able to know that there are resources out there, sometimes it's not accessible to these people. So as an educator, it's about making it accessible as much as possible so that I can help as many people as I can. I feel everybody should be equipped, but we don't live in a perfect world where most people don't feel equipped. And even I myself have been learning and training and taking courses and this and that. I still feel that there's so many other things that I still need to learn as well. So sometimes I do feel that, do I really have all the information to really help someone? So yeah, it's an ongoing journey, and I think sometimes we are too hard on ourselves to feel like it needs to be perfect. It needs to be a perfect time, perfect conversation, and maybe instead think of it as small teachable moments.
But sometimes it's also because, this is how I view consent. It's when someone breach the subject to me at their own will, right? So I don't go about and talk to every person about this sex thing, right? So when if it's just a joke, like saying me and my couple of friends say, hey look, if like this person, that's all I talk about. But if you're talking about the more intimate subjects, like okay, when I cross the line, sometimes people will tell almost all the time people tell me about it, but most of the time I don't broach the subject when people don't preach about it. But then again, there's this conversation that takes place between where some people talk about it, right? When it's a family member who wants to talk about it. But again, it's a very difficult subject. It's because I think it's also because it's between male and female gender power dynamic, right? Where there are it's always being viewed as the guy who has more power when it comes to this conversation to take place. And sometimes we are, and there's a lot of movement these days that they kind of like, hey, look, you are the one with the more power, kind of thing. And sometimes as guys, you're like, okay, look, this is a subject you don't want to really talk about. It's really scary, right? To talk about it, because it may switch into a position where it's not fair it does not put in good life for that guy as well. So it's kind of scary to sometimes as a guy to broach this subject, or even if someone come and talk to me about subject, I'll go, okay, I'll take a step back, and I'm not so sure whether I'm trying to put in a line where we are here to solve the problem of sex, but it's my okay. Look, it's really scary to have this conversation, because whatever conversation that we have, it can be seen as a bad light. You get what I mean?
Yes. It's also the same when we talk about racism in public or politics. It's still the same. Anything we put out there, we have to be responsible for what we say. But if we are coming from a place of, I don't know all the answers, I just want to have a discussion, I'm curious. So like I say, it's not what you say, it's not the sex that's the issue. It can be any topic. It can be money, it can be politics, it can be religion. All of them are sensitive topics if you think about it. But it's the way you talk about it, the tone, the intention behind it. By making it clear, and also who do you talk to about. So being able to practice that muscle and talk to people that you trust, is not going to, who know you enough to not put shade on your character or to like start bad mouthing you behind your back. So the best people to talk to will be your friends, your closest friends that you really, really trust, so that you can practice this. Because if everybody is going around, oh, I'm scared, this is going to affect my reputation, oh, it's a difficult topic, then we never get to practice. And then so do they. They also don't get to practice. So by practicing this with your close friends, then they also have a chance to benefit from it, actually, by what I call being vulnerable and being authentic. So the key being vulnerable, because it is when you are scared that sometimes maybe it's time to heal the shame and the discomfort around sexuality. So it's like working with each other to figure yourself out. And that's what I did. That's what I did before I became a sexologist, before I went and did this training. I asked myself, why is it that I can talk about any topic, frivolous topics, with my girlfriends, and then we don't talk about sex? So I decided to talk about it. I started to say, hey, this is happening in my life, and this is what's happening. This is how I'm feeling, and this is what I'm thinking. And so I have a question for you. What do you think I should do? And then lo and behold, they started to open up about their sex life without me prompting or pushing. And then it feels really, really, really good. It feels really good to be able to feel that I really have a handful of friends that I can be so real with, so vulnerable. And because I was vulnerable first, they in turn became vulnerable with me. And so my work is very vulnerable, because there's this line being between being professional and providing information and content and supporting other people, and yet also sharing a part of myself that is personal and real. Because sometimes in sessions it helps them to be able to get the point, to be able to relate with me, and also be able to relate with like stories of other people. So as a counselor, we have to be very mindful when we share our personal stories. Am I sharing this because I just want to chat with a friend, or am I sharing because there's a learning point to it? So we have to be very mindful when we do personal disclosures as counselors. But especially in my work, it actually is very important to sometimes, when appropriate, disclose a little bit, so that they understand where I'm coming from, who I am, and why I'm saying what I just said.
But putting yourself out there so much, does it affect your life for so far? Has it taken any impact of your life then, because of the work you do and stuff like that?
Yeah, as much as I do disclose, there are things that I also don't disclose. So as much as my work is professional, personal, because it's a private, personal subject, yet on one hand, I don't think anybody can really know fully who you are, because you're just sharing bits of your life and bits of your story. But yeah, even from those little things, people do judge you, and it is hurtful. But then I always focus on the people that I'm helping rather than the people who are
So
trolling.
is there any subject that got so close that you go, ugh, I am not so sure whether I should share this, but you still share it anyways?
Bits and pieces, yeah. So like there was this I can't remember which video I did. So last year I started to, and I really wanted to work with this YouTube channel called She the People TV. So it's a channel I think by like Indian feminist women for other Indian women. And because I'm a sexologist and their content is really about female empowerment, so they got me as their sexpert. And so in one of the videos, I talk about I have had many partners, many partners who have done this to me. Basically, continue to be rough with stimulating me, even though I told them to go slower and softer and gentler, and they just don't listen. And so a lot of people who subsequently commented on that video actually said, "Oh my God, the moment she said many, I stopped watching." Or, "Oh, she's many, so she's a slut," or whatever, you know. And so that is that line of professional and personal, because what I'm trying to say is that how is it that there are so many people who are doing that? It's not a I'm just attacking men. It just happened so many times to me that it's really not funny. Pay attention, guys, you know, like why is this happening? But instead of that, there's that shaming, right? So of course that affected me. Yeah.
I think it's bad. It's a tough subject to breach. Like having because again your subject matter that you decide to talk about is a very personal, it's a very private matter, right? Because it takes me quite a while. Coming from a co-op school, right? But I have this guy that in school that when I was younger, I wasn't sure about I wasn't so sure about how open or I can go with my with my experience with masturbation and stuff like that. Although I do joke about it on stage right now all the time, right? But even if some of my friends, I'm more open to joke about because of my experience with other friends who are from the comedy side of things, right? Where we are okay with talking about that. But when I was younger, right, approaching towards like, the idea of masturbation is to there is one guy from the same class we talk about. He comes in very very strong about masturbation and stuff like that. So it's a very jarring experience for me when that happens, right? But that's how as guys that's how I as a guy would this is how breach it or how I deal with it, right? Just deal with it headstrong and stuff like that and just go. It wasn't until like very late in life you go, okay, there are boundaries that can be set, like there are things that you don't talk about. For the entire sex is one of them where it's a very private matter. So I guess one way for people to deal with like this many with this subject, it is a defense mechanism of like, hey, look, there's this lady who's open, being very, very vulnerable and stuff like that. It kind of like reflects of what I have been doing or what
you have been through.
Yes, and Tara's like, oh, look, this is how I react, how it brought me back to like when I was 15 years old. Yes, and that's how, and that's why it's easier, and it's easier because it's when you watch that video, you kind of see that video, you kind of like, there's no one else to go, look, you should not do that joke, or look, you should not say that comment. It's gonna hurt.
Yes, but when we were young, that's how we learn how to be socially appropriate. A lot of times we learn through pain, through humiliation, through being embarrassed. And then because of that pain of that incident, it's actually a form of trauma. And we don't want to go back to that place anymore. So it brings out all those negative emotions related to that memory. So now that we are older and wiser, it is on us each and every one of us to heal things that doesn't serve us anymore. Take small steps to try it, rehearse it by yourself, and then practice with your friends, and then slowly start to take steps towards healing every part of the sexual stigma and shame, because life is beautiful and it's actually freeing, and we can free ourselves. So it's right what you're saying is reminding me like how my work brings out a lot of emotions for people. So a lot of times the reaction of people is very much about them and it's on them. It's not really for me. And even the one that I just mentioned, the one where people say many, I need to let that slide, and I also need to like heal the part of me that is hurt, so that I don't carry that hurt, and then it continue to affect like the way I show up.
But then again, as what does this is just me of my dumbass talking, right? It's just me go like what does being healed mean? Like being healed when it comes to matters like that? Because to me, healing seems to be like a very vague, generic word that people use. It's a buzzword that people use. Like what does being
healing mean?
Healing. What does the word
to me, healing means that thing that triggers you doesn't trigger you anymore. You can talk about it without pain. It doesn't have the pain associated anymore. So to heal it, a lot of people don't know this, but actually, if you just sit with that pain, that humiliation, that embarrassment, you just sit with it for, I believe, 17 seconds, it shifts. So a lot of time we don't wait, we don't sit with it for 17 seconds. We just like, it's painful. We just like repress it, suppress it, avoid it, run away from it. And so that part is not really fully accepted and acknowledged. Because there is a lot of power in the work that we do. Clients coming in and crying and complaining and like upset and angry and embarrassed and all those negative emotions. But when they really reach a point of it is what it is, there is actually a lot of power. Because from acceptance comes change. Then you go into, been there, done that, what else? So the power of listening to someone and supporting them to process their emotions. So that's sitting with it for 17 seconds, you see? So I love it. I love seeing how when they process their emotions, they transform literally in front of me. Like they just look more alive, more energized. And even though nothing has changed, just sitting with it and accepting it, they change. And of course, I try to, every session with clients, equip them with more skills and knowledge, so that there's no, like, it's not just like unvalidated, like shifting. It shifts with information, knowledge, and like solutions, like knowing what to do makes a lot of people feel a lot less helpless.
Okay. But
so like a homework around sexual shame could be, let's say masturbation, previously, this boy in your life said this. How true was that? So being able to like go and read about it, research about it, and say if things had changed, if I met this boy again, or if I had been able to do this again, like a retake, this is what I could have said. And that by itself is empowerment. That by itself is being able to like process that, so that you could have come up with a better answer. But of course, you couldn't have, because you only know what you knew at that time. But now you know better, and so that allows you the freedom to then move on.
But then again, it feels like it's a punchline for something, right? It feels like it's a thing that people talk. How do I put it? It feels like a punchline because it's like, okay, this is what happens, right? We are taking the power. I'm taking the power back, whatever that means, about what sex means to me, right? And it feels like a punchline to something else. Because to me, talking about sex is it's a very private matter. It's a matter that go, I'm not so sure how this is a good way to talk about and stuff like that. But so things like that happen, right? So but then if I use it as a punchline to something, it does not take away the whole idea of what the experience of sex is. But it's just like, you just shift into something else. You just shift into something.
Deflect.
I'm not so sure deflect is a good word to use, but it feels like, like, hey, I'm saying it out right now, right? It's not, you say it's scary, but hey, you know what? It kind of like divert into, it shift to something else.
I mean, that happens in all conversations anyway, right? Your friends are talking about something, you catch the joke, and then the moment has passed, then now onto another topic.
But it's not another topic, so it becomes like, okay, look, we still talk about sex in a sense, but like kind of like shift into a different meaning altogether for me as a person, right? It's not about like me trying to heal myself, but it's more like a defense mechanism to like go, look, when people talk about this subject, right? I got a joke ready to go, hey, this is not me, right? Hey, you talk about this, I have a joke ready so that when before it hits me, I got something to divert, to change into something else.
Yeah. So this is defense mechanism. So you have to ask yourself who you want to be with who. And then you can decide that I want to be different with this person and be vulnerable so that maybe I can have more skills rather than always doing the same thing all the time. It gets really boring.
So right now is that at what kind of level of vulnerability? Okay, how vulnerable are people, or how forthcoming are people coming to you and just go, hey, look, like this is what we're going to talk about, like how right now, like are people starting to open up, or do you think that the whole conversation is being well taken place in the society itself, or is it getting better?
Yeah, it's getting better actually. I don't see any more difficulties in the last 12 years than in the first year or second year, third year. It has always pretty much been the same, how people are. But I think because of more sex conversations with podcasts, with IG self-declared influencers, that people have more access to conversations and topics brought up around sexuality, that they are actually seeking help earlier, and then there's less stigma and less shame when they come in for sessions. But pretty much a lot of times when they come in, they want to share, they want to open up. I think a big part of my training is really about becoming like sex is just another topic. So when I'm okay, when I'm comfortable, then it allows them to be comfortable. So having done the inner work of working through my own messages and difficulties around sexuality, that I don't have that anymore. So it's a very easy topic for me. So when you're at ease, it put other people at ease, basically.
Is it just sex alone, or is it like, I feel like you need to work through other stuff. I think sex is just a symptom of it.
Yes. So, but because of my niche, because of the way I have been positioned for the last 12 years, they don't see me as somebody who just focuses on relationship. They are coming to me for sex, sex challenges, and then other challenges may come up. So it's the reverse. It's not, we talk about relationship first, then we talk about sex. They always want to talk about sex first, then I realize that they actually have other relationship challenges, communication. In fact, almost like all my clients could do better in being better in communicating. And I wish that, they don't just come to me for the symptom. They come to me for like what's really underlying. So because I've been doing this long enough to be able to see what is happening in the relationship, not just the presenting issue, but the dynamics between them. So I actually already start to cover that topic, like around like the way that they're communicating with each other. I see it and I call them out on it. And
but do they know the issue? But because
so like I said, they are presenting the symptom. They are saying, oh, we're not having sex. But when you ask why, the guy is anxious. Why is the guy anxious? The guy is anxious because the woman is saying this. Why is the woman saying this? Because she's shaming, she's blaming, she's deflecting. And So if she's doing this with sex, is she doing this in other areas of the relationship? And most often it's yes. So this is what I mean. Like the presenting issue is sex, but actually the underlying issue is the way they are functioning and communicating as a couple. So I will call out the root cause, and sometimes they don't like me for it. Sometimes they don't like me because they would like it to be a quick fix.
Oh, yeah.
They would like it to be a pill. But then they don't. When they recognize that it involves them changing their behavior, they don't like it so much.
But are there people who just very adamant about like, hey, look, this is the communication thing that I've presented. Like just go, it is not my fault. Like, why am I still doing this?
Yes. Because it's like he's the one not having sex with me. Why should I change? Yeah. So that can happen. I mean, of course, I'm just mentioning he, her, but actually, it can be, it's gender neutral. It can also be reversed, like the man is doing this, the woman is like this. But yeah, a lot of times, they don't realize their own personality flaws, I guess. Yeah.
Does your family, do you come from a family that's open about sex?
No. I did grow up with a mom who is more educated than other moms. My mom had a secondary school education level, as did my dad. So I did come from a family middle class that somehow my parents are just a little bit more educated. But even then, I didn't have sexuality education from my parents, really, not really. Instead, what I got was kind of like little messages of sex positivity. Like, for instance, before my mom had breast cancer, when I was a kid, around 5, my mom would walk around the house naked very often, and would try to shame her. What are you doing? And then my mom said, this is my body, this is my house. Like, you came from my body, I have nothing to be ashamed of. And I still remember to this date that this is what I mean. Like, in school, everybody will be shame. But if you refuse to be shamed, there is no shame. And by the refusal to be shamed, you're actually modeling, you're actually normalizing nudity, you're actually normalizing, like, what are real bodies. And so yeah, I had that messaging growing up.
I was talking to a friend recently about the idea of why sex is being so taboo. And this is my perspective when it comes to sex, right? Because I think nudity and sex to me it comes from the same sphere, right? Same sphere where we talk about like being when you are open with someone, right? I would like to think that clothing is like an armor, like a metaphorical armor, right? You are, because you can hide things under your clothes, right? You are hiding something under your clothes, and to be intimate with someone, right? It means you take off all your clothing, you're taking off all your vulnerability, and just look, this is just me. This is just my body alone, right? Like there's nothing else. I got nowhere to hide whatever poison or cyanide or whatever things. I got nowhere to hide anymore. And that's why a lot of I think that's the reason why a lot of sex workers are being shamed. That's why there's a lot of there's kind of like heaviness when it comes to sex. That's why there's a lot of pressure on religious why how sacred one's virginity is, because you don't open up to someone so much so that, look, I got nothing to hide anymore, right? It's a metaphorical, it's a ritual to open up to someone and go, look, I got nothing to hide anymore. That's why, and you're free to, and you're I'm allowing you to explore my body as much as you allowing me to explore yours. So that's the idea of why sex to me is so sacred and vulnerable, and this is like, I'm totally vulnerable to you, right? So I think that's where the shame, where there's a lot of people who just had the idea of shame comes in, because it's like, hey, look, it's really scary for me, right, to be so vulnerable to you. Just go, hey, look, I'm naked, I'm nude right now, I got nothing to hide anymore. Like it it's very empowering, right, for that person to feel, but it's also very intimidating to go. What since you can be so vulnerable, so open up to everyone, right? There's a sort of armor, like got nothing to hide anymore. Like why you got that? There's something in there. Like there's a wall of defense that one would have, right? To that, to that thing, right? So so to me it's really it's very positive for your mom to do that, right? And I can see why people are a little bit jarred. I can see why there are people just go, oh my god, like she did that. Why? Like how?
It's so powerful.
Yeah.
It's really powerful memory. Yeah. So I mean, having said that, a lot of the way we think can sometimes be a prison. So it's good to re-examine like where this is coming from, how valid it is. So I guess this is one of the reasons why people like going to nude beaches and nude resorts. They feel this like letting go of these clothes and letting down their guard, letting down their armor, and people are like a lot more real and authentic as well, because physically like letting go of all these layers of clothes. Yeah.
Yeah. So I guess it's like, so it's kind of like, I'm not so sure whether to be presented in that point of view, like saying, hey, look, it's okay to be open with someone to go to go like fully nude, right?
Yeah.
So
there's physical intimacy, letting go of clothes, but there's also other kinds of intimacy, like emotional intimacy, talking about sensitive subjects and being vulnerable. That's kind of what I live for. I really love emotional intimacy, which is why I do what I do, right? I love reading people and really getting to the crux of what is really important, the essence of what makes them feel pain and be able to help them. Yeah.
So
So to me, I think that is actually more difficult than physical intimacy.
I think physical intimacy, it serves as a ritual. It serves as a metaphorical. It serves as a visual guidance, isn't it? Like it's like, okay, it's there. This is, although my mindset isn't that. Although my mindset is just a little bit backwards, but look, it's there. It's the ritual. It's a visual impact of that thing.
I can see how it can help with the preparing for sex. Like I have clients who insist on showering before sex. That by itself, even though you can say, oh, they're just so too focused on being clean, but that by itself can be a really like relaxing ritual of preparing their bodies for something that they view is very sacred. To each their own,
Yeah. To me, it's just okay. Look, like this, because you mentioned that about your mom. You just go, okay, look, like how it can be seen as very jarring sometimes as an outsider, as an outsider. Oh my god, like oh shit. But what about your dad? Like is he very open as well when it comes to his sexuality?
No, my dad is pretty much a no guy. No, like his first response, maybe like my brother always is like, it's easier for them to just say no. So they are like always no to life. And in some ways, I guess I am also, as I get older. I think as we get older, sometimes you do become like a bit of cynical, like, oh, been there, done that, like know everything. But you can't really know everything. You can't have experienced everything. And so I find that I'm developing this tendency as well. So it's really important to notice what is going on in your thoughts and behaviors, and to like call yourself out, especially when you spend a lot of time by yourself, so that you don't put yourself in some kind of a box and then you just become irrelevant.
But is there anything that pique your interest now? Like just you would say yes to? Because it's like I would say no to things that you're not interested in, say yes to something that would pique your interest, right?
Oh, I always say yes to learning. I love studying. I love learning. I have 4 degrees. I just really, really, really love learning. I don't know whether I am making up for the sadness that both my parents have, that they had to stop their studies young. And both of them went through a lot of sacrifices to help us to prioritize our studies, creating the space. I don't know why I feel like crying now. But yeah, it's I just really, really love studying. So I always say yes to studying. And in fact, it's one of the things that gives me the most happiness. If every day I just study a little bit. So like I'm learning Spanish and Vietnamese. What I would like to learn is trauma-informed therapy, how to better support clients who have gone through sexual assault, and also I just keep learning around like supporting clients around sexuality for people with disabilities and people with cancer. Like these are topics that I'm really interested in, because I am working with some organizations on these topics, but also I feel like these people are the most marginalized, most discriminated populations, and if I can serve them, like it would be such a privilege. So now that I have these opportunities, I actually take it very seriously. So I do keep looking out for learning opportunities.
Here is this question that come from my very ignorant self, like saying in like people who have serious disease, when it comes to serious disease, right? When it comes to and then how like are they that in what way are they in what way are people allowed to approach them when it comes to or let me phrase this question properly so that it won't get misunderstood. So if there's if people who in serious disease, right, in disease such as cancer, right, how in what would be a good way to talk about sex with them when they are being approached?
Right from the beginning, like it should be a standard healthcare checklist. That's it. It should be part of the protocol. Because I have cancer survivors who are not told about the side effects of their treatment. To find out that they are developing erectile difficulties of that, or that their vagina has atrophy, or that they're feeling a lot of vaginal dryness, or that their treatment is going to induce them having early menopause. Like these are things being taken away from them without their consent. This shouldn't be happening in this day and age, but it is. And this should be in the part of the preparing your client from their treatment and educating them about their treatment, so that they have a right to say yes or no. It is their body. And yet what is happening is they are going into saving mode, life preservation mode, and certain things are just left out. So they have to deal with the grief of the changes to their sexuality. And I wish our system was better at it.
I think it's also because it's like what the doctor would think it's best for their patients, right?
Who gets to decide? It's their life. It's their body. The doctor is there to support them, not lead their lives for them. And also, what about the fact that they are getting different cancer support when you're in public and private practice, when doctors in public practice are not having enough adequate time between patients, that our system is heavily taxed, that doctors are not having enough time to give quality time, ample time to each patient.
But then again, it's also the amount of doctors versus the amount of patients, right? Like it's because I'm this is just me as a patient being an idiot again, sitting in the waiting room. Go look, it's my time now. I've set that this. I've chosen an appointment of this time, right? I've set this time free. I've been sitting in a room, waiting room. It's 2 hours past the time now, and I'm still waiting for I'm not criticizing I'm not saying I'm not criticizing the doctors here. I'm not criticizing anyone here, but it is what it is. It is how the doctors would. Sometimes doctors will have to talk to patients. I get it. Like that's. But looking at the patient point of view, like saying, sometimes the demand of patients is here. The demand of patients is higher. but the supply of doctors isn't there.
Yes, but what we don't see behind is that the doctors have to do their rounds in the day, in the mornings,
that's right.
and then they have a lot of client appointments, and then they may be called for emergency surgery. So that's what happened once when I give this Dr. Chow Bin, for making me wait for so long. But I didn't know that there was a real reason why. And she couldn't help the fact that an emergency had happened. It was not her fault. So that's what I mean. Like our system is heavily taxed. Doctors being doctors, they are actually, some of them are also doing surgery as well. And when it's an emergency, right? So the system is not, I feel like, giving enough like buffer time. They are like fully utilized, and I think because of all the stresses through COVID, like there are a lot of healthcare providers who have left the system as well. People in public service always wanting to turn private because then they can have better control of their work. So you see that they do care a lot. By going into private, they have to take responsibility of the expenses, the overheads, the administration and all that. But they do that because they genuinely want to be better doctors for their patients. So I mean, previously I was like quite cynical about the medical healthcare system, but as I started to have more doctor friends, I started to really understand how tough it is for them and how thankless it is.
I think it's also like what we perceive in at that point of time. It's easier to go along the lines like, okay, look, it's me. Like, why am I?
Why did it happen to me?
Yeah, it's it happens all the time. Like for me, I'm always in that situation. It takes.
Why am I always in the longer queue?
Yeah, that's why. That's
life.
That's why. It's like, why? So my time isn't as important as the guy in front of me?
Yeah, so we make up a story, right? And it doesn't serve us.
I mean, like, it doesn't serve.
It serves us for the moment to get angry.
I mean, like, it kind of like bring relief to a certain extent. I think that's why.
It also supports the victim mentality, which I'm guilty of. I play victim, and I had to call myself out on it and say I am behaving just like my mom. And there was a time that it served me, and now it doesn't serve me anymore because I want to be a mature grown-up. And so every time I play victim now, I say, there, Martha, you're doing victim again. So then I just snap out of it more and more, and I change the behaviors that was when I was younger, right?
Does you talk about your mom playing victim? What happened? Like can you tell a story?
My mom will complain a lot about her life. Everything will be like me. Why you? My life sucks because of you. So. But we all play different games.
But does she climb out of it? Like does she deal with the situation herself?
I think towards the end of her life, she had a lot of peace, and she grew a lot. She became a different mom. And because she worked on herself and became a different mom, she was much more easy to be around. And so then she became so lovable. I spent a lot more time with my mom. So the saying like, old dogs don't learn new tricks. But the thing is, we are not dogs. And they do change. People do change. I saw my parents change. And because they change, it made it easier for me to to have a better relationship with them.
I feel like sometimes also you need like a life altering event.
Yes, so my mom had breast cancer twice, and that's one of the reasons why I'm so passionate about working with cancer patients. I may not be able to help them with everything, but I can help them in the area of their sexuality. That's what I have to deal with.
But are there people who got who had a big 180-degree change when it comes to
it takes time. It takes time. It's possible, but it takes time. You cannot force anybody to change when they don't want to change, but they can change with more information and knowledge. When they start to realize what they're afraid of is not really that important. But a lot of people don't want to change. So if they don't want to change, you can't force them. But if they're open to listening and having a dialogue, and then shifts can happen.
What are the biggest shifts that you have seen then?
People cannot have sex to have being able to have sex. Yeah, I mean that because like I work with vaginismus clients, right? They are not ready for penetration into their vagina, and so their body shuts down, making penetration difficult, impossible. So from not being able to have sex to being able to have sex, and then knowing that is also that will facilitate them being able to go on and have a baby and have a family. Basically, I am giving, for lack of a better word, I am giving them a life, the life that they want. So for me to be able to see that shift in their faces, their whole bodies, and how it lights up, full of hope and vitality, like that is to me a very big shift.
Thank you for doing this, I guess.
Thank you for having me. It was fun.